If you are sitting there right now, holding your hip, dreading the stairs, and terrified that a hip replacement is going to wipe out your hard-earned retirement savings, I want you to take a deep, deep breath. Because today, we are going to talk about the money. Your money. And we are going to cut through the absolute mud and confusion of Medicare so you know exactly what you are responsible for, down to the penny. Listen to me, your health is your greatest wealth. If you cannot walk, if you cannot play with your grandkids, if you are living in constant pain because you are scared of a medical bill, you are not living a rich life. You are letting fear run the show. The number one question I get from people in your exact shoes is, Susie, what does Medicare actually pay for a hip replacement, and am I going to be left broke? The short answer is yes, Medicare covers it. But, and this is a massive but, Medicare is not a blank check. If you go into this blindly without understanding the difference between Part A, Part B, and where you are having the surgery, you are setting yourself up for a financial shock that you simply cannot afford in retirement. Let's break down the rules of the game. First, Medicare will only pay if the surgery is deemed medically necessary. That means your doctor has to document that you tried the physical therapy, you tried the cortisone shots, you took the anti-inflammatories, and your x-rays show your joint is bone on bone. If your doctor doesn't document this trail of paper properly, Medicare can deny the claim, and you are on the hook for the whole thing. Do not let that happen. Ask your surgeon point blank, have you documented the medical necessity to Medicare's exact standards? Now, let's talk about the real numbers for this year, 2026. Your out-of-pocket costs depend entirely on one major factor: where is the surgeon cutting? Is it inpatient, meaning you are formally admitted to the hospital to stay overnight, or is it outpatient, meaning you go home the exact same day? This choice changes which part of Medicare pays and what you owe. If your doctor admits you to the hospital as an inpatient, you are operating under Medicare Part A. In 2026, the Part A deductible is $1,736. That is your share for the hospital stay. Once you pay that $1,736, Part A covers 100% of your hospital room, your meals, and the nursing care for up to 60 days. So if you stay 1 night or 3 nights as an inpatient, your hospital cost is locked at that deductible. But wait a minute! The hospital stay is only one half of the bill. The doctor who performs the surgery, the anesthesiologist who puts you under, they bill separately under Medicare Part B. And Part B operates on a 20% coinsurance rule. In 2026, after you meet your annual Part B deductible of $283, you are responsible for 20% of the Medicare-approved amount for the doctor's fees. Do you see what is happening here? Without a plan, you are looking at a bill of a few $1,000s just for the day of surgery. And the expenses don't stop when you open your eyes in the recovery room. What about after? You are going to need a walker. You are going to need a cane. That is durable medical equipment, covered under Part B, meaning you owe another 20% of that cost. You are going to need physical therapy to get back on your feet. Medicare Part B covers outpatient physical therapy, but again, you pay 20% of every single session. If you need to go to a skilled nursing facility because you live alone and cannot care for yourself, Part A covers the first 20 days at 100%, but only if you had a qualifying 3-day inpatient stay first. If you are classified as outpatient or just under observation status, Medicare will not pay for that rehab facility. Not one dime. You must know your status. Then there are the prescriptions. Pain medications, antibiotics, blood thinners to prevent clots, those fall under your Part D prescription drug plan. The good news for 2026 is that your total out-of-pocket drug costs are strictly capped at $2,100 for the year, but you will still have copays until you hit that threshold. If you are listening to these numbers and your stomach is turning, thinking about pulling $3,000 or $4,000 out of your retirement accounts, I want you to look at your insurance card right now. Do you have Original Medicare alone, or do you have a Medigap policy? If you have a Medicare supplement plan, like Plan G, it is an absolute lifesaver here. Plan G covers that $1,736 Part A deductible and it covers the 20% Part B coinsurance. If you have Plan G, your total out-of-pocket cost for the entire surgery and your physical therapy could be as low as just your $283 Part B annual deductible. That is the power of being protected. If you have a Medicare Advantage plan, also known as Part C, your rules are different. By law, they must cover the hip replacement, but they don't use Medicare's deductibles. You have to look at your plan's summary of benefits. You will likely pay a set copayment per day for the hospital, or a flat copayment for the surgery, up to your plan's maximum out-of-pocket limit. And you must make sure your surgeon and the hospital are in your plan's network, or you could be left holding the entire bill. Here is your actionable takeaway, your financial marching orders before you schedule that surgery. Step 1. Call your surgeon's office and ask if they accept Medicare assignment. If they don't, they can charge you excess charges. Step 2. Ask the coordinator if the procedure is being coded as inpatient or outpatient, and exactly which surgical center or hospital they are using. Step 3. Call your specific insurance provider, whether it is your Medigap insurer or your Medicare Advantage plan, give them those exact details, and ask them to calculate your estimated out-of-pocket maximum for the procedure. Do not guess. Do not hope for the best. Hope is not a financial plan. Get the facts, secure your approval, protect your savings, and then go get your mobility back. You owe it to yourself to be safe, to be secure, and to be well.